Hello, everyone, and welcome to another episode of the Alex Samu podcast. And today we are doing things a little bit differently. We have none other than Dr. Faith B. Israel. She is a social scientist, now turned politician, and we are exploring the intersection of public health policy and politics. A lot of decisions that affect us in our communities are driven by politicians and decisions they make. We, as healthcare providers and practitioners, need to have a seat at the table. And we welcome Faith to share her experience and her journey with us tonight.
Yes,
Welcome.
welcome, Dr. B.Yisrael, or we'll go by Faith moving forward just to keep it simple, if that's okay.
Yeah.
But first and foremost, thank you very much for taking time out of your busy schedule to be with us. We really do appreciate your time. And also, you are in Trinidad, is that correct?
Right. So thank you for having me. I'm in Trinidad and Tobago, specifically on the smaller of the Twin Islands, which is Tobago. Born and raised right on this wonderful island.
So I've heard about it. So you get Mo, correct me if I'm wrong here. You got to catch a flight if you want to get from Tobago to Trinidad, correct?
Yes.
Yes, a small plane, Alex, which you're scared of.
No,
And
I'm
it
not
usually
scared
takes
of.
about 10 to 15 minutes.
No. I've been on a small plane. Quick, fun story. When I was as a faculty member at University of South Florida, our then program director, Dr. Sandy Quillen, he was in the Navy and he was also a pilot. So he had his own plane. And one day he comes up to me. He's like, "Hey, Alex, I know you went to Florida State in undergrad. I have a meeting over there to speak to the pre-physical therapy program at Florida State University, and I want you to come with me." So I'm thinking, okay, we're gonna drive, or because from Tampa to Tallahassee, it's about 4 hour drive. He's like, "Oh no, we're gonna go on my plane."
Mm.
I'm like, okay. So I tell my wife, and my wife is like, "I don't know that you can do that. Like, we need to get certain stuff in order if you're going up on this plane." So it was cool, fun. I sat with him on is a little 2-seater plane. So much so he's like, "Hey, you're not bringing anything, right? Because like the weight throws off, all that good stuff." So I've been on small planes. It was kind of exciting, but yeah, probably a one and done for me.
Well,
Well,
all planes are a little bit bigger.
thank God. Thank God they're a little bigger than 2 or 3 people on the plane. I actually had to do it today. I had to come from Trinidad today because we had our national budget that was ready yesterday, and I had to go down to Trinidad for that yesterday and back up today. So back and forth is a normal thing for us.
Okay.
Very cool. Very cool.
So, and we've had a lot of guests here who have been from the Caribbean or been from Africa or have African parents or Caribbean parents. And we've all shared that our parents want us to either become doctors, lawyers, or engineers. How did you become a social scientist? I mean,
I think I think this is the Caribbean African story. I literally left Tobago to go to the United States to become a neurosurgeon. That was the plan. That was the
Okay.
plan. I had heard, random news or something, and the single neurosurgeon that was either on the island or in the country was going on vacation, and they said, "Be careful, people. We won't have a neurosurgeon for a month." And I thought that just makes no sense. Let me go be a neurosurgeon, as if you could just do that,
Yeah. You just apply for the job. Like, I'm here.
Yeah, right. The good thing though is that when I got to the University of Pittsburgh, I did undergrad, so I did neurosurgery. My bachelor's degree is in neuroscience, is what my bachelor degree is. And because I was Eunice, because I was able to spend quite a bit of time in the medical field, I coincidentally had a mentor who was teaching in the medical school. So I had, I went with him to medical lectures and to the practical and that kind of stuff. I recognized that traditional medicine was not for me, thank God. And then I figured out what public health was and realized maybe that is the path that I should take instead of the traditional MD kind of thing. And then I realized I could get the master's in public health and I could get the doctoral in public health, which would, satisfy my mother. She could still call me Dr. Faith. So I went ahead and I did a doctoral degree in public health, and I'm actually really glad that I made that switch, because I don't know that I would have been a really good physician. I can't be around the sick individuals and have to deal with that. My personality would not have vibed with that. So I'm kind of glad I made the switch and I figured out what public health was before it was too late.
What about public health made you make that switch? What about public health? What drew you to it?
Because I realized that even though the only thing we knew about health or medicine was the treatment component, there was an entire world that was public health, which includes the preventative stuff. It includes the environmental health stuff. It includes the policy and the economics of health. And it includes all of these other things that are in place to keep the community healthy. And I recognize that even though when I went into it, I thought that I wanted to become a medical doctor because that's the only thing I knew. What I was actually more interested in was community health, was actual true public health. And I'm really glad I was able to make that distinction pretty early up and was able to make that switch.
Now, did you do your studies for the public health stuff here in the States?
Yeah, hi Lystra. I went to the University of Pittsburgh undergrad, and I did both my master's and doctoral degrees at the University of Pittsburgh. Coincidentally, it took me like a 10-year period of just go from undergrad all the way to completing my doctoral degree. And as soon as I was done, I basically packed my bags and came back home.
So the plan was always.
I mean, Pittsburgh is a wonderful place to go to school. No, but the plan was always to come back home. That was all. I actually got a scholarship from the Tobago House of Assembly, and there was an expectation that I would come back home.
What was that adjustment for you like, right? Because you're coming from Caribbean island, sun, beaches, the good life, just a different vibe, right? Like I'm from Colombia, South America. My wife and kids spent a month over there with my parents. I spent a couple of weeks this past summer with my parents. It's just a different vibe, right? When you go anywhere, I'm gonna say outside of the U.S., and I've had a friend of ours that traveled to Portugal not too long ago, and we were talking. It's like it's just different.
Yeah.
When you leave the United States, or for you coming to the United States, it's totally different than anywhere in the world, I think.
It is.
And what was that adjustment like for you?
Well, the good thing is that I have quite a number of family members who live in the United States. So it was normal for me to spend summers in the US, either in New York or in Pittsburgh. So I was very used to what it was like that. In terms of the adjustment for school, I think I've always been just a wherever the world leads me, I will go kind of person. So I think I tend to adjust pretty quickly to whatever the environment is, just because that's just, whatever will happen. If it is God's will, it will happen kind of thing is how I live my life. So the adjustment was actually quite relatively easy. I mean, apart from the typical Caribbean issues of not having all of the finances that you need to and figuring out that part of it and so forth, I actually thought it was a pretty smooth adjustment.
Good.
So you did work in public health before you got into politics. What
Yes.
has been the biggest challenge, or did you think it was going to be easy going from public health into politics and implementing policies, your vision? How has that been?
Well, the reason I got into politics was because the public health that I was experiencing was incomplete. I rebirth. So, what does that mean? I came back to Trinidad and Tobago, actually worked coincidentally in the same division that I am now leading. It was then called Health and Social Services. And I would recognize that having done all of this schooling, coming with all of these wonderful ideas and so forth, making these amazing, in my mind, proposals, um, policies, and so on, sending them up. And then the politicians would be the ones who make the final decisions. And I kind of thought, some of the decisions that the politicians were making, who were obviously not public health trained people, kind of thing, just did not make sense. And in my mind, I needed to figure out a way to get into that little room where those politicians were making those decisions. And the opportunity came for me to join a political organization that I thought kind of fits my philosophy and my ideas. And I thought, why not jump at that opportunity? Why not take it and be a technocratic politician? As a matter of fact, it took me almost a year, 2 years before I was able to identify myself as a politician without absolutely cringing.
Now,
I get it.
is politics in Trinidad and Tobago is similar to here in the States where it's a two-party system, or is it okay?
It has traditionally been a two-party system. Coincidentally, the party that I got involved in was not one of the two major ones at the time. We were able, though, to garner the support of basically everybody who did not support the party that was in power. So we are kind of back now to the two-party system, because it's kind of them and everybody else who was against them who've kind of coalesced to become this single entity now that we're still trying to figure out what that is and maneuver all of the madness of politics.
So I want to piggyback on something that you said, because we always encourage people, we say representation matters, to get a seat at the table. And sometimes when you get a seat at the table, which you do have now, being a public health policymaker, you are now a politician, things get murky and you're not able to carry out the policies or the ideas that you were once sending up to the politicians. Now you are in the seat and seeing why those politicians who were not policy help makers made the decisions that they made. A lot of things are controlled by money. And sometimes people who have done it before and had a seat at the table feel like sometimes their voice aren't being heard and they feel ostracized and they leave. So what do you personally do to overcome that? And what advice would you give to someone who may be interested in becoming involved in politics, whether it's local, state, anywhere in this world?
Yeah, I several things had to happen. I remember having a conversation with my administrator at the time. The administrators are the accounting officers. So there are two of us who lead the division. I am the politician side of it, and then there's the administrator side of it. And we had a conversation, and she said to me, Dr. Faith, you have to remember that you have come into a system that is not moving as quickly as the thoughts in your mind are moving. And you have to be patient enough to remember that everyone honestly doesn't have the information that you have in your head. And everyone is not moving at the speed of you in your head. So you have to figure out how to bring everyone to that level so that we're all moving together in the same direction. And I listened to her and I thought, you are absolutely correct, because there is no point in me going 10 miles an hour while everyone else is going 1 mile an hour. I am going to get frustrated. I am going to get, everything is it's not going to work. And I needed to figure out what needed to happen in the atmosphere to bring people up to my speed, or in some instances, to slow myself down. And that is what I've actually been trying to do over the last 2 years or so, to figure out why people are not moving as quickly as I think they should be moving, and to give them the resources to do that kind of shift. So, I recently recognized that one of the areas that we were having issues was what happens with the accounting people. Because you would do everything, and then if the bill doesn't get paid, or if the check doesn't get cut, the program kind of stops. And I actually sat with the accounting units and just started listening to them. Okay, tell me what's happening, what's going on, how can we help, how can we assist with this. I did the same thing with procurement. What are your challenges? Why is it that stuff ends up on your desk and just sits on your desk for months? And then we had a real honest back and forth about why is it that happens. With my social workers, what's the issue? And they are identifying that we've been working COVID. We did not stop for COVID, very much like the medical people. They did not stop for COVID. So I would say, well, let's start implementing unofficial mental health breaks. Like, they're the ones who could literally tell me they need a spa, and I would say, sure, let's take the entire unit to get a spa, because I recognize that that is what is needed to get them to do what we need them to do. So I am actually seeing now where things are beginning to move closer to the speed that I want them to move, compared to where they were before. And it's a learning process for all of us. So it is something it's working out, I think. Every now and then I become kind of frustrated again, and then I remember that conversation with the administrator, and I remind myself to slow down and bring people along with me.
Well,
What
as,
has been? Go ahead, Mo.
sorry, I was gonna say, as a business owner, you just dropped some gems to be patient. So not only are you a policymaker and politician, you're also a manager of people. And the best businesses, the best political group, they have to master being able to manage people better and better each time. That's how you grow.
Certainly.
What has been the biggest so far, the biggest lesson you've learned in making this transition into politics?
Oh, wow. What has been the biggest lesson? I'm really not sure I know the answer to that question, other than they being patient. Um,
Mhm.
and again, going back to managing people, because it's all about those relationships that you're having with people. Trying to figure out why people do what they do, or why don't they do, or what is the ego issue that's happening, or what is it within their personal life that's causing them to behave the way they do. And really trying to, because I now understand them, I am able to better regulate my response. And I think that is one of the biggest things for me, figuring out how to regulate my response and to not be as quick in be getting upset or chastising or whatever is the automatic thing that I want to do, but figuring out how to regulate my response because I understand where you are coming from.
So, what has been the biggest personal lesson for you? Or what have you recognized about yourself having to step into this role?
That I am not a superhero and that I need to actually actively decide when to stop. That has been my biggest personal lesson because I would go until I crash. And somebody said to me the other day, you are no good to us if you are not here.
It's funny that you say that in a totally different realm, but when you are a prominent person within a system, right, whatever that system is, regulating yourself becomes very important, because to that point of what you were told is, if you run yourself ragged, and we've had that in healthcare where we have clinicians being burnt out and all this stuff for whatever different reasons. It's very similar. I tell my wife, when my wife doesn't feel well and she's a go-getter, my wife does not stop. She doesn't know how to stop. And I have to tell her, I'm like, you need to slow down and you need to take care of yourself, because you're no good to our kids and myself if you're running on fumes.
Yeah.
Right. So you can't be a leader. You can't be that person that people look up to and depend on if yourself, if you're not good with yourself. Right. And I think that when you're in a position like yours, where you're responsible for many different people and many different things, like, you have to take that step back to say, hey, am I good today? Am I at 100% today? And if I'm not, like you said, let's take the spa day, or let's do what we need to do to kind of get ourselves together so that we can do what we need to do.
I don't know. It's kind of tough for politicians because they're like in the public eye and judged day in, day out, no matter what they do. So even if she may recognize that she needs to take a break and slow down, there's somebody saying, look at her, she's not doing anything. She's just there, So you can't, okay, the truth is you can't please everybody, okay? I know personally for me, I had to overcome that fear of, you know what, people are going to talk about you no matter what you do. And the sooner I realized that and I accepted that, the better I became and more confident I became in pursuing my purpose. So I can't tell you as a politician, say screw them, because you need their votes. But I can say in my mind, screw people. Okay, so.
And I have said something very similar to that, and I had to find myself on television apologizing shortly.
So your position, you're elected into this position?
I am elected, yes.
And how long is your term?
It is 4 years. So December would make it to the 2-year point. So we have another 2 years to go in this term.
And then are you able to continue into another set of 4 years if you were to be reelected?
Yeah. There are no term limits as it relates to elected assemblymen in the Tobago House of Assembly. So you could go as long as the people want you and you want to go. At least for now. That is what the rule says for now.
So are you still able, obviously you got the public health aspect was your initial love, your initial passion. Are you still able to do that to a level that is satisfying to you, or have you had to kind of delegate more of that to take on some of the other responsibilities?
So because of the division that I run, it is a public health division. So I have the benefit of having technical people to work with me. So for example, if I need to have a policy written, by no means am I sitting writing it myself. I have technical people who could help. But I am the one who's actually reading it. I am the one who's actually guiding it, indicating that, after we've done the stakeholder stuff and so on, this is what needs to be in the policy, have it written, then we bring it forward and have it, approved and that kind of thing. So I still am able to do quite a bit of the actual public health stuff. During COVID, I was probably happier than most people because this
Why
was
is that? Why is that? Why is that?
because what we were experiencing in COVID was what they taught us at school. And it was finally having an opportunity. I mean, unfortunately, it was, in the grand scheme of things, a horrible experience to go through. But for public health professionals, this is a once in a lifetime opportunity to experience a pandemic, the thing that they teach you about, that really only happens hopefully once in a lifetime, where we had to, practically all of the theories became practice. And that to me was exciting to be a part of the public space, because even though I was not in this position at that time, I still had a loud enough public voice to lend my expertise to do the health education and that kind of stuff that was needed to help the population. So I am still able to do that. I actually just made a conscious decision to continue doing more health education. So even like last week, we had a sitting in the house. I chose to leave the house after I made my presentation to run down to do a quick HIV talk with some young people and to run back up into the house, because that is the kind of stuff that I need to do to keep my love of public health alive.
Let's talk about health education. I'm going to use my mom as an example. I'm sure she's going to call me right after this podcast and blast me. But
our mothers are exactly who they are, right? It is what it is.
It's tough to try to educate persons who are set in their ways. So how has health education been, being educated here and having to return back home to tell people who have survived doing things a certain way for a long period of time that, hey, you gotta choose to do this, do that, do that? How? How has that been?
It goes back to how you do it.
Okay.
Health education requires that you know your audience and that you're able to communicate to the audience that you have. Which means using the language that they understand, using the examples that they understand, and so forth. And I recognize that when I do it that way, you get a better response. Of course, health education only goes so far. We need to have people who can actually change the behaviors that we're asking them to change, and that deficiency is not a Caribbean deficiency. That deficiency is a worldwide kind of deficiency. So it's something that we accept as part of the hard work of public health. But I think understanding also why people think what they think, and being able to use even the traditional things that they hold true to, and bring that into the conversation without totally condemning it. Because the reality is they have survived so far because something that they've been doing has actually been working. That's a fact, whether we want to admit it.
Mom, see, your mom's gonna quote Dr. Faith. As soon as you get that phone call, she's gonna be, you see?
What we need to do, Monique, is to try to figure out which of the things they've been doing is actually good, which of the things that they've been doing is not so good, and then try to figure. So we're not saying get rid of everything. We're saying, let's modify this one little thing. You can keep everything else.
No, I do take her advice, especially on the herbal drinks and tea. And I do share with some clients who don't want to take certain pills, but there are just some things that, I would say to her, like, look, you need to, well, I shouldn't say need. You should, I'm going to rephrase it to meet her expectations. you should try this instead of you need to do this.
No, but the other thing I've recognized too, especially when it comes to traditional or natural medicines, a lot of people don't realize that the reason why our herbs work is because they are actually they are creating chemical reactions in our bodies. And those chemical reactions can be good chemical reactions or they could be bad chemical reactions. And when we get to the point of recognizing that even though it is just garlic or even though it is just fever grass, the reason why it works is because it is actually creating a chemical reaction in your body. And you just want to make sure that the chemical reaction in your body is the right one and not the wrong one. You also want to make sure that the chemical reaction that you get from the fever grass does not counteract with the chemical reaction that you would get from some other medication you're taking, which is why you need to tell your doctor that you are taking both of these things, because you could be causing a whole lot of harm because you are taking both of them and you do not know that they are in your body fighting. And it is those kinds of explanations that we need to give to get people to the point of understanding that no, because it is natural does not mean it is not doing chemistry. It is still chemistry that's happening in your body. But we need to ensure that you keep yourself safe, even with the natural remedies that are causing chemical reactions.
Well, Alex has said Tobago is calm, pretty, nice. It is. Um, how can some of the policies that you and your team implement put Tobago and there in Trinidad on the worldscape of being one of the healthiest places to live?
Well, our mandate is to make Tobago the greatest little island on the planet. And that means us making some difficult decisions. We still have, for example, some of the highest rates of the non-communicable diseases, the diabetes and the heart diseases and those things. Goes right back to our culture of eating and all of the good harvest food. Yes, moms, and the coconut down that we do and all of that. But again, we have to figure out how to still maintain the culture. And we have to also remind people that the world that we used to live in where those things were fine is not the world we're living in anymore. It was okay to eat the dumpling, the dashi, and the cassava and the green fig in the same meal. Well, when you are done, you're walking 10 miles to go home. Not when you're done, you're jumping in your car to go down the road. So there's a big difference in using what we did traditionally and marrying it with the world that we now live in. So our aim really is to, Tobago is at a point where we are still trying to get to a solid foundation. I have come into a space where our healthcare system is beaten. And we now are at the point of just trying to get the basic diagnostic tools up and running, trying to get those simple things going. And then we can start saying to the rest of the world, hey, come, this is an amazing place. And again, I have to remind myself that I have only been in this position for less than 2 years. And 2 years following a pandemic. So really that counts as maybe 3 months in the grand scheme of things. And understand that, yes, we are getting to the point of being able to say to the world that Tobago is a great place, but we need to make it a great place for our residents first, and then they would help us carry that message to the world.
So with you having been in your position just shy of 2 years, what is the thing that as of today you would say you're the most proud of so far?
I answered this question two ways, two things. we had a simple program that we are just about to restart where we were doing cataract surgeries, simple cataracts. And one of the location, I walked into the location at a point when they were doing post-op, just simple post-op visits a day or two after the surgery. And an older gentleman saw me, literally actually saw me, and started singing "I Can See Clearly Now." And that was like, wow. Because I honestly did not think about how debilitating cataracts was, and how something as simple as removing cataract from the eye can literally cause someone to see who was going blind, for a surgery that in the grand scheme of things is a very simple surgery. It is not a very costly surgery, but it is changing their lives. So that's on one end. I am very proud about that. But I think on the other end, I am also, I I see systems beginning to work, meaning um, I would know that I've done my job when people no longer call me for things. So you need an x-ray, or even today my mother messaged me, she's trying to get something and she's complaining that it's taking way longer. And
Mothers.
these Caribbean mothers, it is what it is. And I would actually know that we've done a good job in a year, if in a year from now she goes and she does exactly the same thing, goes back for the same service, and doesn't have to message me because it's taking too long. And I see that we have begun making incremental steps into stuff like that. So stuff, that makes me kind of pat myself on the shoulder a little bit.
So a follow up to that now would be, in 2 years from now, we sit down and have another conversation like we're having tonight. What is the thing that you're like, I did it? Like I, 2 years ago I wasn't here, but
Mm.
looking back now, I did it. What is that? What does that look like for you?
As a politician, I've learned not to give timelines. But
Well, on our platform, you know, I'm
No,
sure
we're
nobody
putting
in the
on the public health
political
policy hat
sphere.
now.
listen, listen, all those people who've been messaging are people who are literally sitting waiting for me to answer that question. um, I actually think one of the things we would have, I'm hoping to accomplish within the next 2 years, is to actually digitize the way we provide social support. So that's the other part of, so even though I'm the public health component, the medical component, the division is also responsible for providing social protection and providing counseling and rental assistance and food support and that kind of stuff for people who are vulnerable. And I am working very closely with my IT, with the leaders in the various units to figure out the best way to digitize the processes that we have. So we actually have a proper case management mechanism where the client does not have to come in literally with their birth paper for us to photocopy it. And yeah, we're still at that point, Monique. Yes. And
Um, um,
Listen, Colombia is not that far ahead either. Okay.
wow.
Look,
I've
I'm not saying anything because I may have to make some trips back home, and I don't want to be cursed out at the airport.
I've
So,
heard some stories. I've heard of things that are like, really, like that's what we're doing. But you know, when you've been in our system, the United States, and how things flow, and then you go back to the Trinidad, Tobago's, Colombia, whatever the case may be, you notice the differences, and you're like, what?
Yeah.
But obviously, it's not as easy as just having somebody develop an app for you, and everything is up and running.
No, because we actually have laws that still speak to the fact that you still need a paper copy for it to be a legal binding thing. So in 2 years, I'm hoping I would have clients who have gotten food support, for example, from us. They've applied, they've actually seen where they are in the process. They are able to go to the supermarkets without even having to come to the office, and they could use their cell phone to make the purchase. That is where I'm hoping we would be in 2 years from now. I need to make sure I pull out this piece and send it to my IT manager, because I am relying heavily on him for this reality.
You know, there are gonna be people that are gonna save clips of this, and in 2 years come back and say, "Dr. Faith, you said this and you said that." I mean, but it's good to be held accountable as a politician, though.
Exactly. I have no issue with that. I have no issue, because it is something that I am working hard on. We actually had plans to be further along, but stuff happens. But it is going to be one of the things that at the end of this first term we are going to be able to do it, because we've set the foundation for it already. So it's really now a matter of implementing quite a bit of it.
Absolutely, and we'll be sure to broadcast that triumph on here again.
In 2 years, in 2 years,
in 2 years when we get together.
So another difference that we spoke about, just talking about the efficiency of getting things done, and yes, it does irk me a bit when I have to get certain things renewed, the process that it takes, because here I could simply go online. So a lot of the clients that I see ask me about the differences in the healthcare system. Mm-hmm. You study here. We have a capitalist free market healthcare system with insurances. Back at home, it's what Americans would traditionally call socialized medicine, free medicine. There are benefits. I always tell people there are pros and cons to each system. I get clients who say, "Well, you guys sit around and wait in the emergency room for hours and hours." I was like, "You do the very same thing here." So you have to wait to get a certain test. I was like, "You do the same thing here." Well, machines are broken and stuff like that. So people would find a stance to defend whatever it is that they believe in and they support. Now, is there a way that you guys can not only modernize healthcare provision, but also incorporate something that those who have the resources can utilize it to?
Oh, I think I know the question as she pops back in.
Yeah.
Sorry, someone tried to call me and it blinked.
Really? So you're using your cell phone?
No, I'm using my iPad, but people go ahead and proceed.
Okay, so that is actually a question that I have been trying to answer myself. The first part of it, meaning, yes, we have it's a single payer system. So I actually try to remind people that it is not free. The healthcare that you're getting in Trinidad and Tobago, it is not free. And I know it is not free because every month I need to write an approval that says, yes, I am approving us handing over, I think the figure is between $42 and $45 million to the TRHA every single month. Yes. So no, the healthcare you are getting is not free. It costs millions and millions and millions. And I prefer it like that so that people do recognize that you're not getting free healthcare. And the fact that you're not getting free healthcare and you're not giving free healthcare means that we have to do the best to make the money that we are paying really worth it. Part of us doing the expansion to get some of those diagnostic tools is so that we can provide a kind of dual system. So regular, everyday kind of story, you're fine, you come in and you get it quote unquote free. But we will try to recoup some of that monies. For example, if we provide MRI screening on weekends for a cost. So those are the kinds of conversations that we've begun having within the division and within the regional health authority to see what is the best way to get something like this done, where we can still provide the service, quote unquote, free of charge to our regular residents, regular citizens, but we can provide a fee for service kind of thing to those who can afford it. We are already we've already started doing that with our hyperbaric chamber at the Roxborough Hospital. Let me say Roxborough Health Facility. We're not quite at a hospital just yet. And one of the projects that we have in train for this next fiscal is to actually do a bigger hyperbaric chamber and advertise that to the Caribbean, saying if you need hyperbaric services, this is where you can come. We've actually had a couple people, a couple divers and individuals who've had various issues come to Tobago to get hyperbaric services, and we've been calculating, if we really were to charge for this, what it would cost and that kind of thing, and putting the system in place to actually collect the fee, because that was one of the sticking points, because we've had the single payer system for so long, we really do not have a regular built-in mechanism to collect or to charge people, particularly if they are individuals who are probably coming from the US, for example, with their own medical insurance. How do we charge the insurance companies and that kind of thing? So we're still trying to work out all of those pieces, but soon enough, maybe not within the next 2 years.
So that's definitely not a 2-year goal.
That's not a 2-year goal. It's not.
That's for the re-election.
Yes. So for citizens of Trinidad and Tobago, if they do travel like to the US and God forbid something happens, how are they covered?
They are not covered. They're on their own. So, and I have had to experience that going to the US, going to the emergency room, and then getting a bill that says each aspirin that I was given cost $5 or whatever the ridiculous figure was, and then having to figure that out. So we do not have a system currently that covers our citizens once they are outside of Trinidad and Tobago. That does not exist. You are on your own, in essence.
How does the reverse work? So if I come to visit and I need to use the facilities and see a medical doctor, whatever the case may be, you just mentioned that your system as of yet isn't necessarily built in to be able to charge people, right? So what happens to the international tourists?
You get free medical care.
And that's the only time Americans would appreciate.
You get, as a matter of fact, it's actually one of the things we recognize that is a little trick that people play, because when they come on the cruise ships, for example, and they get sick on the ships, they ensure that they come off of the ships.
Listen, there's always a scam. There's always a workaround.
Yeah, because once you go to the medical post on the ship, that is like,
that's $1,000 easy.
Exactly. So they get off, they come off of the ship, whether they are crawling, limping, whatever, and then they find themselves into our hospitals. And of course, we would treat them. We will absolutely not just say kick you out. We can't. Well, not that we can't. We will not. We will not do that.
Yes, that's all hospitality, Alex. So yeah. Someone mentioned that you will need to have travel insurance traveling outside of Trinidad and Tobago.
Yep.
So, but definitely. So, also, as I move into the realm of leadership and administrative leadership, sometimes you always hear, "This is how we've done it. This is all how we've always done it. It works." "Quote unquote works." How have you been able, because you are a go-getter and a mover and a shaker, how do you navigate that space of this is how we've always done?
Well, usually, if they're honest, the second part of that statement is usually never said. And even if it is said, it is not true. The part about "and it works." Because frequently that is the stickler. It does not work. And what we've been doing is trying to encourage people to brainstorm on ways to do the things that are simply not working. One of the things I recognize coming in is that those who were there before me were actually part of the problem of individuals would bring recommendations, for example, and it would get stomped on or it will not be implemented. And that would cause people to, pull back and not bring recommendations in the future. But I have actually been really, really encouraging people to come forward with your recommendations on how we could do things differently. And I almost never say no to a good idea, because in my mind, let's try it. What's the worst that could happen? Let's try it. If it works, it works. If it doesn't, it doesn't. It's better than the inertia that we're experiencing. So let us try it. And I think I have been able to express that to my department heads and so forth, so they know it's okay to come to me with a recommendation, because as long as it sounds good, as long as it's not it's not going to cost $1 billion kind of thing, yeah, let's do it, let's see what happens, and we go from there. So I think that has been encouraging to them to come forward with new ideas. And it also means that if I come with a new idea, they're more likely to say, let's try it. Let's work with it, because that's just the environment that I'm hoping to cultivate here.
Being an approachable politician.
What has the representation been at your level now and before? Specifically, obviously, you being a woman, like, are you one of few, one of many? Are you the first? Has it been done before? Like, what has that been in the political world over in Trinidad and Tobago?
Well, as it relates to the gender dynamics, so Trinidad and Tobago has actually done a pretty decent job of ensuring that we've had both male and female politicians. We've done a pretty decent job at that. In Tobago, we have a pretty, almost like an even scale at this point. It's probably not totally even, but we're pretty. It's not. I am certainly not the only one, kind of thing. And we have quite a number of female politicians or female leaders who are sticking their heads out and are making a mark in the community. What we have been able to do is bring quite a bit of technical competence to an area where it was usually just the most popular person. So before, I don't know that there was ever a secretary with responsibility for health, wellness, and social protection who had a doctoral degree in public health. And the same thing really applies in practically all of our divisions, where the person who is heading the division has either really, really significant experience in that field or has really been officially trained in that area. So we really have been able to marry the technical capacity that's needed to run these departments, run these divisions, with the likability, because we still have to get elected. We still have to go out and campaign and convince people to vote for us. What probably worked in our benefit, though, was the fact that the individuals who were there before had been there for quite some time, so I think they got a little complacent as well. And we had that observation that we could campaign on against them, and it worked in our favor. Literally one of our campaign lines was, "You've been there for 21 years and you have not done whatever." And we are in this position able to say, we've been here for less than 2 years, and look, we have done this. Now, granted, I am sure that if we are here for 20 years, this level of enthusiasm is going to start waning by year 10, 15, which is probably why, we probably shouldn't be around for that long anyway. Why no one group of people should be in leadership for that length of period anyway? Because after a while, you get tired, you get burnt out, you start lose all of the ideas you come in with, you lose them after a while, and that's the time for new people to come in and pick up the mantle. So I think that being female, being relatively well educated, although I wouldn't just say educated because we have quite a bit with experience as well. This is a new thing that Tobago is seeing. Youth as well, because our leader, the absolute head of the island, is local parlance a little boy.
He's in
Even
his
to
30s, Alex.
Was that
He's in his 30s.
yeah,
the leader of?
all of
The
us. The
Tobago House of Assembly
gentleman that I
Chairperson.
look up to is a little boy in the grand scheme of things.
Well, that's good. I mean, I think having the youth involved is key. I feel, right, regardless of how you feel or what side of the line they may be on. You know, I
Exactly.
think that we've experienced that here in the United States. You know, over the last 8 to 12 years. You know, the last 2 to 3 election cycles we've had, where the youth have come out and, you know, voiced their opinion and done what they feel is best for them.
Exactly.
So and without that, you can't progress, right? Because as you mentioned, you have individuals who are there for 20 plus years. They get complacent. I've been here, nobody's really challenged me, so I don't really have to do anything to kind of validate my place here, right? I've been here this long. Nobody's really said anything, so I'm just going to continue to do what I have been doing, whether
Yeah.
that's a little or a lot, and be done with it until it's challenged in form or fashion. And truthfully, you know, time is undefeated, right? So eventually your time runs out, and you have to maximize the time that you do have. And the only people that can really challenge that are going to be the younger ones who are motivated, who have this vision and all these things to kind of push it forward.
Mm-hmm.
So as we get close to wrapping up, can you tell me about the pictures you have behind you? Because they're very, very interesting, very pretty looking pictures.
Um, this one was actually a gift from a young lady who happens to be married to an employee here. And it is in honor of the continued efforts of facing COVID-19 pandemic effects. So, it's very eclectic, very, if you actually come and you look at it, it's amazing, all of the things she's been able to capture.
From afar, it looks like an amazing work, and
It's textured and everything as well. This is a picture that so one of the programs at the division is known as the REACH program, Realization for Something. I should know the answer to this question. Anyway.
It's late. Don't worry about it.
So it is actually, part of it is, the social protection of our vulnerable communities. And one of the things we do with our vulnerable communities are we encourage them to start small businesses. And we actually give a small grant to those individuals to get them. We want a situation where we get you to the point where you are no longer our client. And this is actually one of the paintings that I purchased for the division, from one of the clients who was a recipient of the REACH grant. It's one of the paintings that she did, and she was selling for one of the outreach activities that we had with
Amazing.
the division.
I mean, it's beautiful.
Yeah.
And as from the outsider, it just, to me, it screams, what I envision the island to be.
And that is why, as soon as I saw it, I said, I have to get that one.
Good. So since you guys are encouraging small businesses, what about people wanting to pursue healthcare? Because a lot of people see that as one of the biggest challenges.
When you say pursue healthcare, what do you mean?
Excuse me, like start caregiving businesses, um,
Right.
providing home health services.
So it
Sort
is
of stuff like
actually it is encouraged.
that.
That program is not limited to any kind of business. So
Okay.
it almost does not matter what your business is. We, as long as it makes sense, we are going to encourage you. As a matter of fact, I am not sure that we even turn down people, to be honest, because the aim really is to push you to do whatever business it is. So definitely, we've been encouraging people on my as an area representative. So we've been talking about the public health side of it and that kind of stuff. As an assemblyman, I am actually hosting a business fair next week or the week after in Belle in the district, where we are actually encouraging people to come to learn about proposal writing, to learn about the financial sector. Where would you get finances to do whatever business you want to do? And we are encouraging other businesses from the community to come out and showcase this is who you are, this is what you are providing to the community. And we have really been pushing, trying to encourage individuals to get into the various aspects, whatever it may be. And we will try to encourage you, because we want to get people away from being employed with the government to being successful private sector businesses. So we are really encouraging people to get into any of those fields, and we will support you in whatever way we can, even if it's not from my area. The office, under the office of the chief secretary, well, under the office of the secretary for finance, there are larger grants and loans and so forth that are also available for individuals who want to start up businesses.
That's a really good initiative. I encourage people to do it. There's nothing like earning your way. My grandmother used to say, "Blessed is a child who has his own."
Yep.
I am experiencing that, so I encourage you guys to go find out more about the date, the time. Take yourself there, empower yourself, grow, and learn.
Certainly.
And for all those people who have tuned in for the first time to the Alexa Mo podcast, just subscribe on us YouTube, follow us on Facebook, Twitter, Instagram, wherever we're on. We have other interesting conversations with other interesting healthcare people. So please follow us.
Well, Dr. Faith, thank you. Thank you so much. It was truly a pleasure. I've learned a lot about obviously you and what you're doing for your community, and that obviously speaks volumes about the type of person that you are. Obviously, with my relationship with Mo, I've heard great things about Trinidad and Tobago, and hopefully one day soon I can make it over there to experience all that good stuff that you guys have going on. But again, thank you very much. Really do appreciate your time being with us.
Thank you so much for having me. I thoroughly enjoyed this discussion, and definitely in 2 years.
In 2 years,
We will be back.
We'll have you back. Hopefully, I will still not be having a lot of more gray hair, but yes, in 2 years we'll have you back to go over, like, okay, state of Faith's Union. Okay, where you So if anybody tuned into this episode for Bacchanal, you didn't get any. Okay?
Oh Lord.
All right. Well, thank you, everybody. Really do appreciate everybody's support. As Mo mentioned a little bit ago, please follow us, share, like, retweet, all that good stuff. Really means a lot to us. We will continue to put out, great content that hopefully you guys continue to enjoy. Yeah, we look forward to hearing more about what Dr. Faith has got going on and following along her journey as she continues in the next 2 years in trying to meet her goals and provide a good amount of resources for her constituents. So everybody have a wonderful evening, and God bless.